as one of the oldest and most progressive hospitals in the country. Chinese General Hospital and Medical Center has endured and withstood the test of time. Its creed of caring for patients regardless of nationality, race, social standings.
You know, the Chinese General Hospital started out as a herbal house 130 years ago. It's organized by that time the Chinese community. But in 1911, when Dr. Tihan Ki, the father of the Supreme Court Justice of the Philippines, came here, he envisioned it to be a real Western hospital with training for other specialties.
The origins of the Chinese General Hospital and Medical Center is probably closely intertwined with the beginnings of the Chinese cemetery and the cholera epidemics of the 1800s. The Spanish authorities in those days segregated the non-Catholic Chinese and required them to live in the Parian from the Catholic Chinese who were allowed to settle in Binondo. During the 1800s cholera epidemics, as there were no more spaces in the municipal cemeteries for the deceased, the Spanish governor in 1843 decreed that a cemetery be established in the hills of La Loma, 2 kilometers from the city. This was called the Cementerio de Binondo, or what was to be the La Loma Catholic Cemetery. Due to the urgings of the non-Catholic Chinese for a cemetery of their own, a piece of land adjacent to the Cementerio de Binondo was donated by the Capitan of the Chinese Community Guild, or the Gremio de Chinos, Lim Ong, in 1863 in fulfillment of an election promise. A few years later, another businessman, Don Mariano Fernando Yuchinco, purchased an additional adjacent plot of land from the Dominican order for 14,000 pesos, making these Chinese community-owned land a total of 54 hectares. The land where now stands the Chinese General Hospital and the Chinese Cemetery. It is now easy to surmise that because of the deaths that these cholera epidemics brought, that the Chinese community would set up a clinic to minister to the health needs of their members in land that the Chinese community now owned. Thus, the Chinese General Hospital was born in a time of pestilence and established due to the need to serve a community, and still a legacy that continues today after 130 years.
I was born in 1964 here. I'm the fourth of 9 children. And if I'm not mistaken, all 8 of us, except one, were born in Chinese Gen. So my dad is a old-timer in the hospital. He started here, I think, in 1961. And my father is Dr. Lu Tan, who was head of the emergency room department years ago.
As the eldest daughter of 2 physicians, having worked here, it's very heartwarming that I was born here. I literally grew up in this environment. Well, basically, the only thing I was trained for in medical school was just academics, diagnosing, treatment, management of cases, and taking care of patients when they are sick. And it's still a work in progress for me to realize that there are still a lot of things that I have to learn. And I still envision to have an extension or a creation of more services to better serve the Filipino-Chinese community.
Giving back to the institution is easy because we all consider this as our second home.
It's nice to give back to the institution that has trained me, and I am glad that I am sharing whatever expertise or what I have trained to help further train our younger colleagues.
The Chinese General Hospital and Medical Center is home of 3 generations of medical professionals of our family. Our family is very proud to be part of this prestigious medical institution and will continue to support all its activities in the coming years.
I think what's important is that we do it the Chinese General Hospital way. We take care of our patients. We don't worry about their status in life. It is never about the fees. It is always about taking care of them and making sure we prolong both quality and quantity of life.
No less than Dr. James D. He said, "Is the Medical Staff Association so important?" I said, yes, it's very important. It should provide a venue for doctors to know what they want for this hospital. After that, he gave us a good chance to open the formation of the MSA, we call it, Medical Staff Association. That was the time that Pinatubo ruptured also. So when Pinatubo ruptured, I thought this is a good time for the doctors to show their skill and their compassions too. And we rented 2 big buses. One of them is for the doctors and the dentists too. And another one is to buy medications, food supplies, blankets, mosquito nets, everything. And we started going there. At that point, we wanted to congregate just using the name of Chinese General Medical Center.
With the formation of the MSA, initiated by Dr. Carlos Lu, it was really a good chance for us to be together in our effort to cooperate with the administration of the Chinese General Hospital to improve our patients' care, to improve our association with the community, and as a whole to the nation that we serve.
Dr. Tiangki established the nursing school 1921, the first nursing school. No? And as a medical director now, I see myself as a part of the continuum of the mission started by Tiangki to continue as a training centers for future healthcare workers, specifically physicians, nurses, medtech, radtech, every specialty. We are a non-stock, non-profit organization, and we should focus on that. All the monies earned by the hospital should go back, should plow back to the hospital. Number 1, to improve our patient services. And number 2, more specifically, more importantly, to help our less fortunate countrymen, both Chinese Filipino and Filipino. And together with that, we are going to expand our training programs in all aspects of medicine, like medical oncology, surgical oncology, radiation oncology, pain management, and other specialties.
As I see it, the major factor that most hospitals have always faced is financial. A good working relation with PhilHealth will be a major advantage. Chinese General Hospital and Medical Center has been fortunate to have a very supportive and understanding board and the president and CEO who provide the needed logistics for the infrastructures, equipments, and facilities to stay at pace or even ahead of the other progressive hospitals.
There's a lot to be thankful for because the administration has been very positive in their efforts to improve not only the infrastructure, new buildings, but in the form of equipments that will provide our physicians, our consultants, the chance to use them for the diagnostic and therapeutic needs of our patients.
The hospital officials, the board of directors of the Philippine Chinese Charitable Association, through its chairman and the president and CEO, and the medical director, had been the key factors in its legacy. Leaders like Dr. Tiangki, Dr. Nubla, Dr. Vicente Dizon Sr., Dr. James D., Dr. Bilito Gopin, and currently Mr. Kelly is here. Everyone connected with the hospital had in one way or another contributed to the legacies of the hospital.
In March 1996, with the vision and support of Dr. James D., we formally inaugurated the CGH Heart Institute, and a milestone was erected. Over the years, we continue to upgrade, and for the long time through to the present, we remain as an institution to watch. The foremost challenge today is to stay ahead and remain competitive with the 52 other hospitals that have heart programs in the Philippines today.
We are also paying tribute to our doctors, nurses, medical staff, and workers for their valuable contribution and unwavering support in this institution in continue providing quality medical care for our patients. The Philippine Chinese Charitable Association, the owner and operator of CGHMC, is truly grateful for your service. We are very proud of what we have achieved for the past 130 years.
As I reflect on our eventful journey over 130 years, it is incredibly rewarding to be a part of this unique mission to help take care of the sick and become instrumental in improving the lives of so many people. It gives me hope for our future. I wish that our journey serves an inspiration for future generations to work harder together for another century of meaningful service in building a healthy community.